what is healthy masturbation? So you deal only with men, or women also come to you?
Yeah, but actually masturbation is common in both male and female, but it is much more common in the male. The frequency is much more common in the male, and what I will say, percentage is also common in more in male. So few females, or I will say more than 60 to 70% female do masturbate, but they are hesitant to commit that. They rarely do tell that, or they don't know that what they are doing is the masturbation many times. So basically, whether it is man or male or female, masturbation is healthy process. We know that previously, before 1950, what we'll say, the people used to get married early in their life. Like they used to be 12, 13 or 14, and they used to get married. So they were exposed to the sex. They were able to do the sex at that age itself. When they were like just entering the adolescence and this phase of life, so they were like able to do that. Now what happened is that the age of getting marriage is like going almost 25, 30, and sometimes 35 also. And like in Western countries, we can't have sex before marriage. That our culture doesn't allow that, or says it's not good to do that. So because of these things, there is the sexual energy in male and female, and it needs to be get channelized. If they don't have the chance to do the sex, or they can't do the sex, then this is the alternative, healthy alternative, what I will say, to channelize their sexual energy. Because every 7 days, 15 days, or at least once in a month, they have that urge to have sexual intercourse or have sex. So this needs to be channelized somewhere. So doing masturbation is a good thing, or a good way to do that, rather than going somewhere like red zone or red light area, what we will say, or commercial sex workers, or what we say. So rather than that, this is the good thing, that we don't indulge in sex with the wrong partner. So this is the good thing to do, but they have to take some precautions, specifically male, that they have to be in a secluded place. They should have a private space for that, at least for 1 hour. It's they can't do it in a hurry, like they went to the bathroom and just in 5 minutes they finish that act. So this will lead to the premature ejaculation like problems. So there should be personal space. They should have sufficient time. They should do it gradually, and most important, there should not be any guilt about that. Many people do have guilt, like while doing that they enjoy it very much, but once it is finished, they start getting that guilt, that why I have done that, I have decided not to do that, because they have many misconceptions in their mind, that masturbation leads to the decrease in the size of the penis, masturbation leads to the slightly deviation, or what do we say, angle of the penis, or one of the testicles may get small, or the semen may finish after some days. So there are many misconceptions about that. So they start developing that guilt. So the patient or the person should not have that guilt after doing the masturbation. And likewise, female also can do the masturbation. There is nothing wrong in that. But there are two ways to do masturbation in the female. Some do with the stimulation of the clitoris, which is the elevated part in front of the vagina. So one is that way, and another is using some object to insert into the penis and masturbating. So there are the two ways. Some do, most of the women do the first one, that stimulating clitoris. So there is nothing wrong in that. There should not be any hesitation, but what they should have the privacy, that no one is watching them, so that nowadays blackmailing or something kind of things also happen. So they have to take care of this thing itself.